Hi, Dr. Lindsey. Wendy's on vacation today, so I'm doing a journal review from the Hair Transplant Forum International. It's a journal that we all get when we're members of the ISHRS. And it's usually got some good information, but this in particular is a pretty decent article by a guy named Michael Beehner, who's a hair transplant doctor in Saratoga Springs, New York. I've never met Dr. Beehner. I've seen some of his patients, and I think from what I know, he's a very well-respected man, and he's ethical. And this article from July and August 2020 on page 121, I think gives some good advice to hair transplant doctors, and probably for patients as well. I won't read the whole thing. A couple things that I found in here. Most of our great results occur in patients with full-bodied hair who have great donor density with plenty of 2 and 3 hair grafts. That is exactly right. And so if you look at our videos and our website, we talk about thin versus fat hair. Really the best results occur in somebody with thick, bushy, coarse, curly hair that's in similar color to the underlying scalp. It's hard to get a bad result in a patient like that. Unfortunately, most people walking into this office don't have that. They have finer hair, they have a big color contrast, and so it's critical that when you go to see whatever doctor you're going to, that he shows you examples, or he or she shows you examples of hair similar to you. I saw a fellow that came in here from Philadelphia just a couple days ago with a limited amount of skinny hair, and I'm not completely sure he's a candidate. And he said that the last 2 places he went, they showed him guys with great hair and great results. You could sell anybody anything if you show them results that may not be achievable. So I think that Dr. Beehner is exactly right. You got to show photos that match with the patient's head. These near miraculous results are simply not going to happen with low density fine hair. Amen, Dr. Beehner, and all you potential patients should think that through if you've been told that it's going to be a perfect result and you got skinny hair. This guy also adds, or Dr. Beehner also adds, and for patients with fine hair, it'll often take 3 sessions. Well, I would agree with that. I tell most patients, I would agree with that. I tell pretty much every patient that we're doing the front on, later when we do the back, I think we ought to add a couple hundred hairs to the hairline, because no matter how good it turns out, you always want a few more hairs, and particularly with finer hair guys, you're definitely going to need more hairs in the hairline. You might need some in the middle, because simply fine hairs and skinny trees don't cover real estate as well as fat trees do. So I think this guy is right on. Dr. Beehner also comments on female hair transplant patients, which make up 20% of his practice. Females make up about 5% of my practice. He talks to them about shaving and shock loss, which I think is critical. We see a few females in here per year that weren't shaved, and then during their hair transplant, and then when in the recovery phase at 1 month when their hair comes out, they get a lot of shock loss, and they say they weren't prepared for that. I think perhaps one of the reasons why we only do 5% females is because we shave the areas we work in to get what I think is a better result. And there's no shock loss because we already shaved it. But I think he's absolutely right on. You got to be prepared for shock loss, whether you're a man, but particularly for a woman, and be able to camouflage that or potentially not do the surgery. And lastly, he talks about scars. And I talk a lot about scars. I've done 4,150 facelifts, so I think I sew pretty well. I still get mostly scars that are about 1.1 millimeters, like that thing right there. I get about 10 scars that are just almost imperceptible, and I get about 6 scars per year that are wide, crappy scars, 6 or 7 millimeters. And it's probably because of some healing characteristics of the patient, at least at our office, because everybody gets sewn up the same way. But you can't always get perfect scars. And so when we do a scar repair coming in from someplace else, I mean, I don't know how it was sewn up before, so we will often do a scar excision Many times that improves things dramatically, but not always, probably because that person has poor or scarring tendencies. And so Dr. Beehner mentions that he will make one attempt at a scar excision, and if it doesn't improve significantly, then he'll FUE into the scars. And I completely agree with that. We will attempt a scar excision, wait a year and see how things pan out. If it's really good, probably nothing else needs. If it's pretty good, maybe nothing else is needed. Maybe we need to put some FUEs into it. And if it's not that good because of healing tendencies generally of the patient, then yeah, FUEing into those scars is a viable option. So in summary, Dr. Beehner in New York has a bunch of good comments in this article. Again, I don't know the man. I think he comes across as ethical, and I applaud his publication of this paper, or this article. If we can help you, please give us a call. Thanks.